Hi, I'm Dr. Sarah Collins, and I need you to stop what you're doing for just 30 seconds because what I'm about to tell you could change your life. If you're over 50, 60, or 70, this matters more than anything else your doctor may have told you about your blood sugar. What if I told you that the numbers your doctor is asking you to hit every day could actually be harming you? Not because your doctor is careless, but because standard guidelines treat everyone the same. The same target used for a healthy 35-year-old is often applied to someone 68, 75, or even 82, and research shows this approach is dangerous. Keeping blood sugar too low in older adults is linked to more falls, more confusion, more hospitalizations, and even more deaths. Yet most doctors still follow these outdated rules. I've spent 20 years working with diabetic patients, watching what happens when blood sugar targets are set wrong. I've seen falls, dangerous hypoglycemia, cognitive decline, all because tight control was applied to someone whose body couldn't safely handle it. And I want to help you avoid the same fate. Let me tell you about Harold, who was 78 years old and had been diabetic for over a decade. His doctor proudly showed him perfect numbers: fasting blood sugar under 100, A1C at 6.3, 3 medications, insulin at bedtime. Harold nodded along, trusting the expertise of his doctor, but inside he felt terrible. At first, it was occasional shakiness in the middle of the night. His wife, Ellen, would wake up to find him confused, sweating, disoriented. She started checking his blood sugar. Sometimes it was 55, 52, dangerously low. She'd rush to get juice, nurse him back to normal, and hope it didn't happen again. Soon, these episodes escalated. Harold began having them multiple times per week, during the day and night. He tried to tell his doctor, but the A1C looked perfect. The doctor told him, "These occasional lows are manageable. Keep glucose tablets handy. Eat a snack before bed." So Harold followed instructions meticulously, became hypervigilant about preventing lows, but the dangerous episodes didn't stop. One afternoon, while driving to the grocery store, the shakiness hit him hard. His vision blurred, his hands shook, and his mind went fuzzy. He couldn't even open his glucose tablets. The car drifted into oncoming traffic. Harold lost consciousness. When he woke up in the ER, his blood sugar was 48, dangerously low. His arm and ribs were broken, and he had caused harm to another person. An endocrinologist reviewed Harold's case and explained something his regular doctor never did. For a 78-year-old with frequent hypoglycemia, an A1C of 6.3 is actually dangerous. The goal for someone his age is preventing hypoglycemia, not chasing perfect numbers. Age-appropriate targets are higher, safer, and help maintain independence and quality of life. Harold's story is a warning, and it's not unique. Too many older adults are living in fear of blood sugar lows because doctors follow outdated, one-size-fits-all guidelines. Now let's take a closer look at why this happens. Most doctors are unknowingly following outdated beliefs about blood sugar in older adults, and those beliefs can be deadly. Let me break it down. First, there's this common idea that lower blood sugar is always better, no matter your age. That comes from studies done decades ago, studies that were revolutionary for younger adults. They proved that tight blood sugar control prevents complications like kidney damage, nerve problems, and blindness. That was true, but only for younger diabetics, typically in their late 20s to early 50s. Older adults, however, are a completely different situation. Frail adults over 70 or 80 often have other health conditions: weaker kidneys, slower metabolism, and a brain that's more sensitive to low sugar. For them, chasing the same perfect numbers can cause severe hypoglycemia, falls, confusion, hospitalizations, and even death. Research is clear on this, but many doctors haven't adjusted their approach. They generalize the guidelines, assuming what works for a 35-year-old will work for a 75-year-old. It doesn't, and patients like Harold suffer. Then there's the belief that preventing long-term complications should always come first. Think about it logically. If you're 35, aggressive control makes sense. You might develop complications decades later, So reducing risk now is smart. But if you're 82, the risks of strict control today outweigh the benefits decades from now. A fall caused by low blood sugar could be catastrophic today, while the complication you're trying to prevent might never happen. Prioritizing tomorrow over today in older adults can be deadly. Another big mistake is over-reliance on A1C. This number measures average blood sugar over 3 months. It's useful, but it hides swings. A perfect 6.5 on paper could mean blood sugar drops to 50 multiple times a week and spikes to 200 in between. Harold's A1C looked great, but those frequent lows were life-threatening. For seniors, preventing lows is far more important than achieving a low average. Stable numbers that keep you safe are the priority, not chasing perfection. Doctors also often assume the same medications and doses work for everyone. Sulfonylureas, insulin, and some oral medications can drop blood sugar too far if kidneys aren't filtering efficiently, which happens naturally with age. A dose safe for a 40-year-old might be excessive for a 75-year-old, causing dangerous hypoglycemia. Yet many older adults are still treated with the same strict regimens without adjustments for age or frailty. Finally, doctors are trained to trust objective numbers more than how you feel. Lab results are clear and reproducible. Symptoms feel subjective. If you're exhausted, shaky, or scared from low blood sugar, the doctor might see a perfect A1C and dismiss your complaints. Harold experienced this for months. His fear, his nightly rescues by Ellen, and the constant vigilance were ignored because the numbers looked perfect. This approach puts safety and independence at risk. These false beliefs are why so many older adults are being overtreated. Tight targets, too many medications, frequent hypoglycemia, constant fear, falls, accidents, and ruined quality of life. Harold's story is not an exception. It's a warning. But there's a solution. You can have safe, age-appropriate targets that keep you feeling well, independent, and protected from hypoglycemia. In the next part, I'm going to break down the 6 signs that your blood sugar targets are too strict for your age and health, so you can see if you might be in Harold's situation right now. These are real warning signs that too many seniors miss, thinking it's just normal aging or just diabetes. Now, let's get real about the warning signs that your blood sugar targets might be too strict for you. These are the red flags that most seniors ignore because they think it's just part of getting older or normal diabetes. But ignoring them can be dangerous. Sign number 6 is frequent hypoglycemia. If your blood sugar drops below 70 more than once or twice a month, or if it dips below 55 even once, you're in trouble. This isn't a minor inconvenience. Hypoglycemia can cause confusion, fainting, falls, seizures, and even death. It's not something to manage with snacks or glucose tablets alone. For seniors, preventing lows is more important than chasing a perfect A1C. Research and the American Diabetes Association are clear on this. If you're experiencing frequent lows, your targets are too strict, period. Sign number 5 is unexplained falls. If you find yourself falling more often and can't explain why, low blood sugar could be the hidden culprit. Many seniors assume it's aging, arthritis, or weak muscles, but hypoglycemia causes dizziness, weakness, and sudden confusion, all of which increase fall risk dramatically. If you're diabetic and falling frequently, low blood sugar needs to be considered, not ignored. Sign number 4 is worsening confusion or memory problems. If your thinking has become foggy since your doctor tightened your blood sugar control, don't chalk it up to normal aging just yet. Recurrent hypoglycemia can damage brain cells over time. One episode might not show noticeable damage, but repeated drops starve your brain of glucose and slowly harm neurons. What feels like normal forgetfulness could actually be your blood sugar management harming your brain. Sign number 3 is constant hunger or needing frequent snacks to prevent lows. If you're eating snacks every couple of hours or before bed just to stay safe, your medications are too strong. This is not normal diabetes management. It's a constant struggle to prevent dangerous side effects from overtreatment. Seniors shouldn't have to plan their entire day around avoiding low blood sugar. Sign number 2 is feeling terrible despite good numbers. Maybe your A1C looks perfect on paper, but you feel exhausted, shaky, weak, or just off most of the time. Good numbers that make you feel awful aren't actually good. They're wrong. Quality of life matters. Feeling well matters. If your daily life is compromised just to achieve lab perfection, something needs to change. Finally, sign number 1 is needing help from others because of low blood sugar episodes. If your spouse, partner, or family members are constantly monitoring you, helping you with glucose tablets, or checking your blood sugar at night, your targets are too aggressive. Losing independence because of strict control is unacceptable. Safety and quality of life must come first. These 6 signs aren't minor. They're serious indicators that your blood sugar goals are harming you rather than helping. If you see yourself in any of these situations, it's time to take action. You don't have to live in fear, constantly checking your sugar, worrying about falls, or feeling your memory slipping. Age-appropriate targets exist, and they can protect you while keeping your numbers reasonably controlled. In the next part, I'll reveal exact age-specific blood sugar targets based on current research and expert guidelines, so you'll know what's safe for your age and health status. You'll learn what's appropriate for healthy seniors, those with some medical conditions, and even frail adults over 85. These targets are designed to prevent hypoglycemia, protect your brain, and maintain independence, while still managing diabetes effectively. Now that you understand the warning signs, let's talk about what your blood sugar targets should actually be based on age and health status. This is where most seniors finally get clarity, because what's perfect for a 35-year-old is actually dangerous for someone over 65. I'm Dr. Sarah Collins, and I've seen firsthand what happens when targets are too strict. It's not just numbers on paper, it's your life, your independence, your safety. For healthy older adults aged 65 to 75, who have few other medical issues and maintain good functional status, blood sugar control can still be reasonably tight without risking harm. Fasting blood sugar should be between 90 and 130 mg/dl before meals. Bedtime sugar should be around 110 to 150 mg/dl. And the A1C target, about 7.0 to 7.5%. These ranges strike a balance. They prevent long-term complications while minimizing hypoglycemia risk. You still get control, but without putting yourself in constant danger. For seniors aged 75 to 85 who have some medical conditions or moderate functional impairment, the targets shift a bit. Fasting blood sugar should be 100 to 140 mg/dl before meals, bedtime 120 to 160 mg/dl, and A1C 7.5 to 8.0%. The focus here is on immediate safety. You're not just preventing kidney disease or vision loss decades from now, you're preventing falls, confusion, and dangerous low blood sugar today. This approach is backed by research showing that slightly higher targets reduce hypoglycemia while still controlling diabetes effectively. For frail adults over 85, or those with multiple serious medical conditions, limited life expectancy, or advanced dementia, targets need to prioritize comfort and safety above all else. Fasting sugar should be 110 to 150 mg/dl, bedtime 130 to 180 mg/dl, and A1C 8.0 to 9.0%. At this stage, there's no benefit to aggressive control. Tight targets here don't prevent complications. They increase the risk of dangerous lows, falls, and hospitalizations. The goal is simple: prevent symptoms from very high blood sugar while absolutely avoiding hypoglycemia. Quality of life is the priority, not perfect numbers. It's critical to remember that these targets are not one-size-fits-all. Age matters, but so does health status. A healthy, active 75-year-old may tolerate slightly tighter control than a 75-year-old with heart disease, kidney problems, or cognitive decline. Other factors include your risk of hypoglycemia, whether you drive, your living situation, your personal preferences, and your support system. All of these affect what safe, appropriate targets are for you. Many seniors don't realize that following generic targets for younger adults can be dangerous. Strict numbers on paper may look perfect, but they can lead to frequent lows, falls, fear, confusion, and even serious accidents. Relaxing your targets to age-appropriate levels not only protects your health, it improves your daily life. You can feel more energetic, reduce anxiety, sleep better, and maintain independence. In the next part, I'll show you exact steps for talking to your doctor about adjusting your blood sugar targets safely, including what evidence to bring, how to frame the conversation, and even trial approaches that make your doctor more likely to agree. This is the roadmap to finally taking control of your health without fear, frustration, or dangerous overtreatment. Now that you know what age-appropriate blood sugar targets look like, the next step is learning how to talk to your doctor about them. I'm Dr. Sarah Collins, and I've guided hundreds of seniors through this process. This part is crucial because even when you know your targets, getting your doctor to adjust them safely can be challenging. Step 1 is gather your evidence. Print the American Diabetes Association guidelines for older adults. These are publicly available online. Highlight the sections about age-specific targets. Bringing official guidelines to your appointment shows your doctor you're informed and serious. It's far more persuasive than just saying, "I read something online." Your doctor can't dismiss an established authority like the ADA. Step 2 is document your symptoms. Keep a log for 2 weeks before your appointment. Write down every episode of low blood sugar, shakiness, confusion, sweating, dizziness, or weakness. Include every snack or glucose tablet you had to take, every fall, and every time someone had to check on you. Objective documentation makes the problem undeniable. It transforms vague complaints into hard evidence your doctor must consider. Step 3 is make it a conversation, not a confrontation. Avoid statements like, "You're treating me wrong." Instead, say, "I've been reading the ADA guidelines for older adults. They recommend more relaxed targets for someone my age. I've been having frequent lows. Could we discuss whether my current targets are appropriate?" This approach is collaborative. You're bringing information, asking for input, not accusing, not demanding. Doctors respond better when they feel like partners in decision-making. Step 4 is emphasize safety. Frame your discussion around avoiding harm. Doctors are trained from day one. First, do no harm. Highlight your concerns about falls, confusion, or hypoglycemia. Say, "The guidelines say preventing low blood sugar should be the priority for seniors. Could we adjust my targets to reduce my risk?" Framing the issue as safety rather than numbers resonates strongly with physicians. Step 5 is propose a trial period. If your doctor hesitates, suggest testing higher targets for a defined period, like 3 months. Monitor your blood sugar, symptoms, and hypoglycemia frequency. If you feel better without complications, you can continue the higher targets. Trials are less intimidating than permanent changes and often get agreement. Step 6 is be prepared to compromise. Your doctor may not fully accept the relaxed targets at first. Even meeting halfway, like adjusting fasting sugar from under 100 to 120 milliliters DL, reduces risk significantly. Small improvements are better than none, and you can adjust further as your doctor sees progress. Finally, know when to get a second opinion. If your doctor refuses to consider age-appropriate targets despite evidence and clear symptoms, consult a specialist. Endocrinologists or geriatricians who focus on older adults often understand relaxed targets and hypoglycemia prevention better. Don't stay in a situation where overtreatment could be harming you. Following these steps gives you a roadmap to safe, effective diabetes management tailored to your age and health. Age-appropriate targets protect your life, independence, and quality of life. You don't need to fear lows, falls, or hospitalizations. You can feel confident, safe, and empowered. Remember, Perfect numbers on paper aren't worth losing your independence or risking your life. Your health, comfort, and safety come first. Implementing age-appropriate targets changes everything. You sleep better, move freely, and live fully without fear of hidden dangers from overtreatment. This is the freedom and security every senior deserves.